Hi, welcome to Sims MedPrep. Dr. Kamran Khaja is here. In this video, I have explained what is the splitting of S2 in a very beautiful sketch. In this sketch, I have explained different type of splitting, what is on the right side, what is on the left side, what is up and what is down. So you can watch this video. It is easy and you can memorize it. Thank you so much.
What is the splitting of S2? What is physiological splitting? Okay, when there is inspiration, there is a drop in intrathoracic pressure. When we get some breathing during inspiration, the intrathoracic pressure is decreased. Okay, you know that all the major vessels are in the thoracic. So what will happen when there is a decreased pressure in this intrathoracic level? The pressure on inferior vena cava is also decreased. It is common sense. When there is decreased pressure in inferior vena cava, so what will be happen? Venous return will increase. When venous return is increased, the right ventricular filling will be increased. And right ventricular filling, its mean more will be stroke volume. Mean more of the blood will go from the right ventricle into the pulmonary trunk, and more of the blood will go from pulmonary to the left atrium, and more will go from left atrium to the left ventricle, and more will left ventricle to pumping out of aorta, and more will be stroke volume. Okay, so in simple, during inspiration, venous return is increased, stroke volume is increased. And the most important time, when there is a more blood in the right ventricle will take much time to eject this blood. Okay, एक नॉर्मल पेशेंट्स है, ठीक है, उसमें नॉर्मली क्या होता है, जब हम नॉर्मल इंस्पिरेशन के अलावा हम वैसे ब्रीदिंग के दौरान हमारा जो साइकिल होता है, राइट, जो एट्रियम से राइट वेंट्रिकल ब्लड आता है, लाइक वो 50 ml. Okay, so right ventricle easily eject करता है, but when there is a more blood, more venous return during intrathoracic pressure is decreased, so what will happen, there will be a more time during ejection. So it is increased right ventricular ejection time. It will cause the delayed closure of pulmonic valve. Okay. So what will happen? Delayed closure of pulmonic valve. Okay. First of all, we should know that, okay, which valve close later, pulmonic or aortic. Okay. So you know that pulmonic valve closes later as compared to aortic valve. Okay. So we know a aortic valve and pulmonic valve both closes simultaneously, but not. There is a gap. There is a delay, which is called normal delay here. Okay, this is normal delay. First is closure of aortic valve, and there is a closure of pulmonic valve. Okay, why? Because due to increased venous return during inspiration, pulmonic valve closes late because of increased right ventricular ejection time. Okay, so when there is a decreased pulmonary impedance, it is the capacity of the pulmonary circulation during inspiration. So what happened during inspiration? Pulmonary circulation capacity is increased. Okay, so it's further contribute that the pulmonic valve should close later down. A delay must happen. Okay, so in simple summary of that, what is physiologic splitting? The physiologic splitting is a normal delay between the aortic and pulmonic valve. It's mean the first there is the closure of aortic valve, and then there is a closure of the pulmonic. So when I will say S2, it has two components. Okay, S2. One is A2, it is AS mean aortic component, and P2P is pulmonic component. This is aortic component and P is the pulmonic component. Okay, so normally you can see in this picture during the expiration there is a no change. This is the normal. Okay, because there is a only delay in the inspiration. This is normal. You can see expiration, there is a nothing, it's okay, but inspiration, this delay between this layer of aortic component and pulmonic component, you can see in the red, this is a some having a delay. First aortic valve closes and there is a layer of pulmonic valve. This is called normal delay. Okay, why it happens? Due to the inspiration, due to it is called physiologic splitting. Now next we will do our topic. What are the pathologies of related to this S2? Okay, what are the different splitting mechanism in S2? Okay, I will make some diagram, which is very important diagram for all of you people. Okay, and I recommend all of you to draw this diagram. Okay, in your notebook. First of all, we will in the middle we will have a fixed splitting in the middle. Okay, and on the right side I will draw with this color. And on the left side, I will draw with this color, green color. Okay. On the above, I will draw with blue color. And on the below, I will draw with this color. Okay. So when you are remembering the splitting of S2, always remember that on middle, which is a fixed splitting of the S2, in the middle, this is a fixed splitting of the S2. This happens due to the ASD, atrial septal defect, which is a fixed splitting. Okay, this is fixed splitting. When I will go to the right side, this is the right side, this is right side. So what will be the cause? It will be a wide split on the right side. Remember, it will be a wide split on the right side. So what are the causes of wide splitting on? These are the right bundle branch block. Remember always, this is right side. So it is cause is the right bundle branch block. And the next is the right-sided valve stenosis, so which is pulmonic stenosis. So it is very important to make it simple and easier method to remember is that draw this for on the right side there is a wide splitting and wide splitting happens in right bundle branch block and pulmonic stenosis. Now going to the left side. So what will be happening on the left? This is left side L. So it is the paradoxical. Okay. So paradoxical splitting. What are the causes of paradoxical splitting? Left bundle branch block. It is left side, so it is left bundle branch block and left-sided valve stenosis. Left-sided, which is counterpart of pulmonic is aortic stenosis. Aortic stenosis, but severe aortic stenosis. This is very important. Okay, so what we have discussed that number one, there is a fixed splitting, which is atrial septal defect. It happened. Number two, we have discussed that on the right side, there is a wide splitting because it is on the right side. So there will be the right bundle branch block and right-sided pulmonic stenosis. On the left side, there is a third point, which is paradoxical splitting, and that paradoxical splitting is in the left side. So it is will be the left bundle branch block and left-sided of the valve stenosis, that is aortic stenosis. Okay, then the fourth point. Next, you will see in the diagram, I have make this up. Up mean high, high mean loud. So what will be the cause of the loud S2? And what will be the cause of the soft S2? SOFT soft. So in the upper there is a loud S2, in the lower which is soft S2. So what are the causes of the loud S2? Loud S2, hypertension. Okay, hypertension. And what are the causes of soft S2? That is the mild aortic stenosis. Mild aortic stenosis. So it is very, very important concept here. Oh, okay, so we discussed 1, 2, 3, and the fourth was soft, which is going down, and fifth point was loud. So it is very important, and all the people must draw this very beautiful algorithm. So what are the splitting? It is very easy to remember from this diagram. Okay, so first of all, I can repeat in just a 1 minute. Just 1 minute. First of all, in the middle, in a fixed, you should have to draw fixed splitting of S2, that is in atrial septal defect, and you must draw a right side and the left side. On the right side, there is the wide splitting that happen in the right-sided right bundle branch block and right-sided valve stenosis. This is pulmonic stenosis. And the left side, there is a paradoxical that is happen. This is a left, so it is left bundle branch block and the severe aortic stenosis. Severe aortic stenosis. Okay. And the fourth point, which is a lower area, that is soft splitting that happen in mild aortic stenosis. And the fifth point, which is loud splitting, loud S2, it is actually the soft and loud S2 is not splitting, but it is actually cause. Okay, what is the disease in which soft S2 occurs? Aortic stenosis. What is the disease in which there is a loud S2, that is hypertension? Okay, so this was our main and easy concepts. Now we are going to our topic. A quick summary: wide splitting. So always remember, I will make that same color. So we discussed the wide splitting. Okay, with this color. So remember, it was on the right side. It was on the right side. So what will be happening? It will happening in pulmonary stenosis and right pulmonary. So what will happen? The wide splitting. Actually, the word wide is exaggeration of normal. Okay, it is exaggeration of normal splitting. You can see this. This is abnormal delay. Normal was present when we see previously that it was like this delay, but it is exaggeration. So it is just exaggeration of the normal splitting. Okay, and the next we discuss that, which is the paradoxical, which is green. Okay, and then we discuss the fixed stability. Okay, fixed was very easy. Fixed was very easy. It is an interoceptal defect. Okay, when there is a, so you can see in this diagram, it is a fixed expiration and inspiration, both having a fixed delay. This is a fixed delay. Delay is present, but it is fixed, and we cannot appreciate by listening the sounds. So it is independent of respiration. It's mean when we listen the, we cannot appreciate because both expiration and inspiration having the same delay. It is fixed stability. Now, paradoxical splitting, we discussed paradoxical splitting. It happened on the left side, L, and it is a left bundle branch block and the spare aortic stenosis. In this paradoxical, what is paradoxical? Paradoxical is mean that it is just reverse paradoxic because we studied that the delay happens in inspiration. We studied that delay happens on inspiration, but this paradoxical splitting will occur on in expiration. On expiration, the split can be heard, not in inspiration. This is why it is called paradoxical. Okay. Normally we discuss it's happen in inspiration, but in paradoxical splitting, it will happen on the expiration. Okay. So we have discussed the splitting of the S2. That is very important topic, and I made a very beautiful diagram to memorize it so simple. Thank you.